Have you ever listened to doctors or vets and just felt completely lost? Like they're speaking a totally different language? Well, guess what? They kind of are. But here's the thing. It's not a language meant to exclude you. It's more like a secret code, and it's all about being incredibly precise. So, in the next few minutes, we're going to crack that code together.
All right, so first things first. Why on earth does this language seem so complicated? Let's dig into why it can feel so, intimidating when you first hear it.
Let's just put a word up on the screen. Arterial sclerosis. I mean, wow, that is a mouthful, right? It just looks complicated, maybe even a little bit scary. And it's words exactly like this one that can make science and medicine feel, well, unapproachable.
And if you're thinking, that sounds like Greek to me, you've pretty much hit the nail on the head. A huge chunk of this terminology is built from Old Greek and Latin. But that's not an accident. It's totally by design. And it's actually our first big clue for decoding what all these words really mean.
Now this is the most important thing to get. This language was never, ever meant to be confusing. It was built to be universal, to be so incredibly precise that a scientist in one country knows exactly what a doctor in another country is talking about. There's just no room for confusion.
So how do we actually learn to read it? It's simpler than you think. We just learn how to break these huge, scary words down into their tiny little parts. It's time to crack the code.
You see, most of these big terms are really just combinations of three simple building blocks. You've got a prefix at the beginning, a root word that holds the core meaning, and a suffix at the end. Once you learn just a few of these, you can suddenly start to figure out what hundreds of words mean.
Let's try one out. Hypoglycemia. Okay, let's break it apart. Hypo, that's a prefix that means under or less. Then there's glyc, that's the root for sugar. And the suffix, emia, that refers to a condition of the blood. So let's put it all together. Under sugar blood, or as we usually say it, low blood sugar. See? It's like a little puzzle.
All right, let's do a quick one. Cardiology. You probably already know this one, right? The root card means heart, and that suffix, -logy, just means the study of. So cardiology is the study of the heart. Simple as that. You're already getting the hang of this.
Okay, so figuring out the words themselves is one thing. But what about describing where something is on the body? For that, we need a sort of biological GPS system, a body compass.
First up, we've got the main axis. For both people and animals, cranial means toward the head, and caudal means toward the tail. Head to tail, that's our main line, our north and south.
Next, let's think top to bottom. Dorsal is anything toward the back or the spine. And here's the easiest way to remember that one. Think of a dolphin's dorsal fin. It's always on its back, right? The opposite of that is ventral, which just means toward the belly side.
And what about when we're talking about arms and legs? We use proximal and distal. Proximal means closer to the center of the body. Think proximity. And distal means farther away. Think distant. So your elbow is proximal to your wrist, but your fingers are distal to your wrist.
Makes sense, right?
But this is where it gets really interesting, because this whole language system has to be able to adapt. I mean, a human standing up on two legs is oriented completely differently from a dog or a horse that's on all fours.
So for us, it's pretty straightforward. Anterior is the front of your body, posterior is the back. But now picture a cat. What's its front? Is it its face? What about its chest, which is on its underside? See? Using human terms would just be a total mess. That's why veterinary medicine had to develop its own super precise modifications.
Now look at how this all applies to an animal's head. See that line running right down the middle? That's called the median plane. Anything moving towards that line is medial, and anything moving away from it is lateral. And then if we look from the side, dorsal is the top of the skull and ventral is the bottom.
And there's one more really cool, special term just for the head, rostro. You only use this word when talking about the head, and it simply means toward the nose. It gives you a perfect, specific direction on one of the most complex parts of the body.
This level of detail goes all the way down to the legs. For the lower parts of the limbs, you need even more special terms. Palmar refers to the back surface of the front leg. Think about the palm of your hand. And plantar refers to the back surface of the hind leg, like where you would plant your foot. It just shows how this language adapts to be perfectly clear no matter what the anatomy looks like.
So, after all this decoding and all these new terms, what's the big takeaway? Well, it all boils down to one simple idea: the power of precision.
This isn't just a bunch of academic talk. This language is a critical tool. It's what makes sure that a vet in Spain and a surgeon in Japan are describing the exact same spot on the body. There's no room for error, no chance for a dangerous misunderstanding. It literally saves lives.
It really all comes down to what one of our sources points out. In the study and daily work of any field of science, it is necessary to understand the specialized terminology that is used. At the end of the day, getting this language is just fundamental to how science works.
And if you think about it, this kind of precise coded language is everywhere, from law to engineering to computer coding. It's a great reminder that something that first seems like a barrier is often just a doorway into a much deeper, more accurate way of seeing the world. So the only real question left is, what other secret codes are you going to start